Hello everybody, I'm Chiara from Spezzeria Palazzo Vecchio and today I'm gonna talk to you about hepatobiliary disorders. This kind of disorders affects the liver, which is the largest gland in our body and one of the most important organs. Liver is mainly associated with the function of a filter and detox organ. Actually, it not only filters, but is also the seat of metabolism for most of the macromolecules in our body. Let's take a closer look. Liver produces and secretes bile, which is used to emulsify fats. It also performs numerous functions in the metabolism of carbohydrates and proteins. In liver occurs the synthesis of cholesterol and triglycerides. Liver produces clotting factors, but one of the main liver activities is the detoxification of body from toxins, waste, and other harmful elements. Having a detox function, it is also more exposed to harmful attacks. All this makes liver a very vulnerable organ. Viral infections, alcohol abuse, smoking, drugs, excess fat in diet can cause damage and dysfunctions. Let's see now what are the main pathologies affecting liver. First of all, we have hepatitis, which is inflammation of liver caused mainly by viruses, but also attributable to intoxications by alcohol or drugs or poisons, by autoimmune diseases, and also hereditary conditions. Then we have steatosis, which is an excessive accumulation of fat, especially triglycerides, within hepatocytes, which consequently die. It is an often asymptomatic and common disease among obese people. Only in a small percentage of cases, it can develop into steatohepatitis or cirrhosis. Cirrhosis itself is the effect of chronic inflammation of liver, often attributable to alcohol abuse, which destroys hepatocytes, which are replaced by fibrous and scar tissue, which reduces, even irreversibly, the function of the organ. Last, we have liver cancer. This severe liver disease causes the organ to enlarge, which in advanced stages is such that it produces pain. It is frequently associated with liver cirrhosis. Each of these diseases is characterized and also the cause of liver failure. That is, liver is unable to work as it should and therefore struggles to free us from toxins. Liver dysfunction produces many effects and complications. Liver is no longer able to adequately metabolize and eliminate bilirubin, which is a waste product that forms when all red blood cells are destroyed. Bilirubin, which is yellow, tends to accumulate in blood and is deposited in skin. This causes jaundice, which is characterized by yellowish skin and sclera of the eyes. Liver is no longer able to synthesize sufficient proteins to promote clotting. The result is a tendency for bleeding and bruising and is called coagulopathy. But blood pressure in veins that carry blood from the intestine to the liver is often abnormally high, and this is called portal hypertension. Brain function can deteriorate because liver cannot remove toxic substances and as it normally does, and these build up in the blood. This disease is called hepatic encephalopathy. Up to half of people with hepatic insufficiency also have kidney failure. Hepatic failure leading to kidney failure is called hepatorenal syndrome. There is a malfunction of the immune system which increases the risk of infections. People may have metabolic abnormalities such as low blood potassium levels, is called hypokalemia, or low blood sugar, is called hypoglycemia. Liver, together with kidney, intestine, and skin, is part of those organs responsible for expelling from body everything that is not a food or is dangerous for body. Liver has all the characteristics necessary to eliminate toxins. But if the amount of toxin is excessive, liver is not able to dispose of them properly by itself. To keep this organ healthy, the important thing would be not to overload it and therefore not to increase the load of toxins in body. In this regard, there are many natural active ingredients that can help, which can also protect hepatocytes. The hepatoprotector par excellence is milk thistle, a plant similar to artichoke that protects hepatocytes by producing glutathione, which acts as a hepatoprotector, and also activates RNA polymerase, which is the enzyme involved in cell duplication, so it is able to regenerate damaged hepatocytes. These properties are attributable to the active ingredient Silymarin, which, as indicated by the WHO monograph, has shown anti-hepatotoxic activity, especially against drugs. As I told you before, milk thistle is similar to artichoke, which is a plant we have already encountered when we talked about diabetes, but also about hypercholesterolemia in our previous videos. Artichoke is an excellent hepatoprotector, effective especially in situations of fatty liver, as demonstrated in many clinical studies, where patients have found clear improvements without side effects. Therefore, the artichoke is a simple remedy within everyone's reach. Another plant I want to tell you about is Schisandra, because in addition to having a hepatoprotective action, being a type of ginseng, it also has a tonic action. So it is useful for pulling up a stressed or overworked liver. Well, so far we have talked about mainly hepatoprotective plants, which detoxify liver. However, these toxins, once removed from liver, are put back into circulation, so they need to be expelled from body. That's why it is essential to consider diuretic plants such as, for example, dandelion, of which we also have WHO monographs that demonstrate not only an effective diuretic and anti-constipation action, but also choleretic action. That is, it stimulates the production of bile. Another useful plant in this sense is birch, thanks to its active ingredient Hyperoside. It is a molecule belonging to the flavonoid family that has diuretic activity and promotes the elimination of nitrogenous compounds and chlorides that are harmful for the body. If taken long term, it helps in the elimination of kidney stones and bladder. Well, we have introduced all these 5 active ingredients. Hello everybody, I'm Chiara from Spezzeria Palazzo Vecchio, and today I'm gonna talk to you about hepatobiliary disorders. This kind of disorders affects liver, which is the largest gland in our body and one of the most important organs. Liver is mainly associated with the function of a filter and detox organ. Actually, it not only filters, but is also the seat of metabolism for most of the macromolecules in our body. Let's take a closer look. Liver produces and secretes bile, which is used to emulsify fats. It also performs numerous functions in the